COVID-related deaths in Africa have been steadily rising and on the continent by about 21%, and the increase in deaths by 16% as well. Now, a report by the African Union and the Africa CDC shows that the cases of the infections have also been rising by 16%. And as Chemutai Goin reports, these developments are attributed to the Delta variant and dropping of the guard by citizens in most African countries.
Though noting that Tanzania had not reported on its COVID-19 situation since May 2020, the Africa CDC, in conjunction with the African Union, released statistics for the epidemiological week 28. The report showing that the average overall positivity rate among the 54 member states was 11%, and the 25% of the member states representing 14 countries reported positivity rates higher than 12%. Of concern too is the fact that in the period between 12th June and 18th July this year, there was a 21% rise in new deaths. Last week alone, the number rose from 5,492 to 6,161. New cases increased by 16%. The Africa CDC further noting that more countries continue to report varying variants of the coronavirus disease. Their study showing that 38 countries were still dealing with the Alpha variant, which was the first strain of the virus, 32 others battling the Beta variant, while 21 countries were now grappling with the Delta variant, which doctors say presents more severe symptoms.
Through to the county of Mandera.
Speaking in Mandera County as IGAD handed over an ambulance to the Ministry of Health and the Mandera County government to aid in the COVID-19 response in the Bodia area of Elwak, Health Chief Administrative Secretary Dr. Rashid Aman noted that the Delta variant was spreading faster in the country.
What we are seeing in the country now is the widespread transmission of likely the Delta virus. It is beginning to replace the earlier virus that was there, the UK strain, and now we have Delta virus. So this is not again unusual because other countries have reported this. In the US, for example, now it is the predominant circulating COVID-19 virus. So Delta is going to be here with us. We don't know what will come next.
And though Kemri had forecasted a peak by mid-July, Dr. Aman warned that Kenya was not out of the woods yet, stressing caution.
The spread of this thing is unpredictable. However, when we are approaching a peak, we will be able to tell because we will know from the hospitalizations, especially ICU requiring mechanical ventilation. We will know from deaths and all of that. We can be able to pick. There has to be a level of consistency of rise of these things that can predict to you that yes, now you're moving up at a high gradient. I don't think we are there yet, but we know it is going to come at some point.
The IGAD Executive Secretary revealed that the organization would continue supporting its member countries combat COVID-19 while also boosting efforts towards minimizing cross-border conflict.
Despite of sovereignty and borders, we were looking this morning, visiting the hospitals, one hospital which is covered all the costs by the Kenyan government, which is used by the Ethiopians and the Somalis. This is really what we mean integration, the community integration. Borders are meaningless when we talk about society.
We can't be safe if our neighbors are unsafe. We can't be well if our neighbors are unwell. And so what we have is our school system in Mandera supports our neighbors. Our health system in Mandera supports our neighbors, and nobody will come unwell to the hospital that gets turned away.
The advent of COVID-19 posed new challenges for many counties, particularly those living in the border. And for Mandera County, it is no different. It borders Somalia and Ethiopia. The government forced to put in place measures that will mitigate against the effects of the virus, while at the same time facilitating cross-border trade, which is relied upon by the residents. Chemutai Goin, Citizen TV, Mandera County.